Hi, my name is Yvette, and this is my administration of an intramuscular injection skills video. First, we're going to do is we're going to gather supplies. I have my gloves, I have some alcohol pads, my gauze, my medication, a 3 ml syringe. I'm sorry. Yeah, a 3 ml syringe, a 22 to 25 gauge needle, and it has to be 1 to 1.5 inch. My it's not really soap. My hand sanitizer in a Sharps container. And I have my patient. So first we're gonna do is, I'm gonna go to my EHR. I'm gonna verify that the patient, the doctor has ordered morphine 6 milligrams IM and for 1 dose for the patient for pain. The vial that I have reads morphine sulfate 4 milligram per ml. So that means I'm going to be giving the patient 1.5 mLs for this injection. So once I verified it first time, I'm going to make sure I do my 6 rights, right patient, right drug, dose, time, route, and documentation. So first we're going to do is we're going to now go to the patient's room. I'm going to come into the room, provide for privacy. I'm going to perform hand hygiene. I'm going to introduce myself to the patient. Hi, my name is Yvette, and I'm going to be your nurse today. It looks like the doctor has ordered some pain medication for you for morphine. This is going to take a couple of minutes. Morphine is going to help it's going to help for your pain to help reduce the receptors of pain in your body. And this procedure is going to take, like I said, a couple minutes. Okay. Can I have you confirm your name and date of birth for me, please? John Smith, January 1st, 1950. Perfect. Do you have any allergies that I need to be made aware of? No? Any type of allergies? No? Perfect. Do you have any questions for me? No. Okay, thank you. And I did that with the AID by introducing myself to the patient and all that. Next, what we're going to do is, again, we're going to compare what we have. So again, it looks like the doctor has ordered for you 6 milligrams per IM. This is going to be an injection, a 1 dose for your pain. So what we're going to do, again, perform hand hygiene. We're going to put on our gloves. Okay. Before I give you this injection, I do want you to know that there is morphine, again, is to help to reduce your pain receptors of pain. There can be some possible side effects with this medication. You can experience some drowsiness and some constipation. Some adverse side effects that we would need to be made aware of very quickly is if you have any difficulty breathing or any hives. During the injection, you might feel some burning or tingling at the injection site, and that's perfectly normal and should subside as soon as we're done once we're done giving you the shot. Okay, do you have any questions for me? No, perfect. Okay, so what I'm gonna do is I'm gonna grab my medication, I'm gonna uncap that, and we're gonna clean the vial, just like that. We're gonna grab our syringe. And our needle. What we're gonna do is we're gonna face it down, and we're gonna 1.5. Perfect. We're gonna take out the put it to the level of the air, 1.5, and then I'm gonna take off this and inject it into my bottle, and we're gonna face it forward and go to 1.5. And what we're going to do is we're going to slowly cut. Just like that, okay? Okay. just to make sure. Oh. Showing at 1.5 mL. Okay. Perfect. Okay. So what we're gonna do is we're gonna put our needle down, and we're going. And if this is okay, just gonna confirm with the patient. I'm gonna put them in a comfortable position. I'm gonna have them turn to either their right or left side, or on their hip. So what we're gonna do, I have the patient lying laterally, and I have their hip. So I'm gonna put my palm on the greater trochanter. I'm gonna point my thumb towards the patient's groin, my index finger towards the superior of the spine, and my middle finger towards the iliac crest. Crest. I'm so sorry. So that's gonna be about here. Okay. So what we're gonna do with my alcohol, I'm gonna clean circularly from the inside out, and I'm gonna just leave it here to see where my injection site's gonna be. And then what I'm gonna do is I'm gonna grab my needle, and I'm gonna grab the patient. I'm gonna pull this, I'm gonna grab my patient like this, grab where I'm comfortable, and I'm gonna uncap. No, I'm gonna uncap. I'm gonna go grab like this and get the patient where I'm comfortable. I'm gonna go at a 90-degree angle, and I'll push down. And I'm gonna go 10 seconds per ml. Once I'm done, I'll slowly come out. Now I'm gonna put this in the sharps container. Okay, and then I'm gonna observe the patient and make sure that they're not bleeding or anything. If they're bleeding, you would just slightly dab. I'm not gonna be massaging the area or anything like that. For some reason I missed this. When I had picked this injection site, I made sure that there was no redness, no swelling, no indications of pain, making sure the patient signs of infection or anything that is wrong with the skin or the integrity of the skin or anything like that. So once I'm done with the shot, I put the syringe over there. I'm gonna remove my gloves. I'm gonna ask the patient if they're doing okay. You're okay? Any questions? I'm gonna gather my supplies and my trash. Again, I'm gonna say thank you to my patient. Thank you for allowing me to give you a shot today. I am all done with the procedure. Do you have any questions for me? No? Perfect, thank you. I'm gonna perform hand hygiene. Like I said, I'm gonna gather all my supplies. I'm gonna throw it away, and then I'm gonna be leaving the room to document this procedure. And that's it. Thank you.